If I really look back at my 20 years in dentistry, and I can't believe it's actually in my 20th year now of practice, and if I look back and I had to say, what has been, one material that I can really point to and say, this has had a significant impact on my practice. And without a doubt, for me, that material would be e.max. To look at a case like this where someone comes in, if they have some failing amalgams, they might have large direct restorations, they have recurrent decay, they might have fractures, they have multiple things going on in the posterior dentition, yet they are a cosmetically motivated patient. Prior to 2005, it was really questionable as to what material you're going to use for those patients if you wanted to have both a functional and cosmetic end result. And e.max for me has been that material that allows me to feel the comfort of getting great aesthetics in first and second molars, even premolars, whether it be inlays or onlays. I have phenomenal aesthetics, yet I also have phenomenal strength, and I can really hang my hat on that I'm not going to see failures on first and second molars when I handle this material correctly and the lab handles it correctly, which they do, and we either bond it or cement it according to manufacturer's protocols. And I really look at this material and say, you know what, this has literally revolutionized my practice, because I can come in and treat this patient who is aesthetically driven. And likewise, I can do an onlay on a patient on a first molar here who really, it's a maxillary first molar. That person might not be so aesthetically driven, but at the same point in time, they are functionally driven with that end result. And again, that's a material that I can bond in place. I know it's going to be strong for me, and it's going to have a great end result. Let's talk about for a moment the strength of e.max. Because for me, and for many of you, this might be confusing as to what we see in some current marketing that's driven by Ivoclar, who manufactures e.max. And one of the things that I noticed is in some current marketing is that the new strength of e.max, and it's the new e.max that you always know. There's a tagline similar to that. And I've seen some people on forums say that they reformulated e.max, and now they're reporting that it has a 500 megapascal strength and not just a 400 megapascal strength. And what really is the driving force behind this? Well, I can tell you is that there has been no formula changes that have undergone in e.max, but what Ivoclar has now is literally countless years of research, over 11 years of research in which they have done tear strengths and compressive value strengths, and they can look at e.max and say, well, with thousands of values for e.max CAD, they have now tested it on average at 536 megapascals. For e.max press, in literally thousands of mean values, that has tested on average at 473 megapascals. And when you combine e.max CAD and e.max press with over 3,000 values, you look at the average at 506 megapascals. So this is where Ivoclar is now driving their marketing, saying, e.max has over a 500 megapascal strength.